In an operating room at the University of Pittsburgh, a surgical team prepares a pig for experimental heart surgery like it's never been done before.
So what we have here is what we call a snake robot.
It's a surgical tool designed to snake its way through the body and perform a wide variety of procedures. It's got tiny forceps to gather tissue samples, a light to guide the way, and a fiber optic camera. Today, the SnakeBot will enter the chest through a small incision and twist its way to the far side of the heart to perform a procedure that's usually impossible without opening up the chest. It'll deploy a tiny catheter that emits radio waves to zap a small area of heart tissue that can cause an irregular heartbeat. The surgical SnakeBot is the brainchild of University of Pittsburgh heart surgeon Marco Zanotti, robotics researcher Howie Choset, and his team from the nearby Robotics Institute at Carnegie Mellon University.
My research group has been working on snake robots for quite a long time, primarily for urban search and rescue. So the principal benefit of these snake robots is that they have these many degrees of freedom. You know, your elbow has 1 degree of freedom, the snake robot has 16 degrees of freedom, and it can use those degrees of freedom to thread through tightly packed volumes and get to places that machinery and people otherwise cannot normally access.
Dr. Zanotti teamed up with Choset because he wants to use that versatility to help doctors operate on people in less invasive ways.
So robotics allows a surgeon to have the capabilities to go beyond being human.
So Zanotti invited Choset into the operating room to witness heart surgery, and the roboticist invited the surgeon to his lab to see his SnakeBots. Together, they had to design a machine that was a lot smaller than the lab's other creations, with even simpler mechanics to make tighter twists and turns inside the body. The robot and pilot are performing well. A surgeon has opened the pig's chest to provide a better view of the heart. The SnakeBot navigates between the heart and the pericardial sac, apparently doing no damage along the way. The SnakeBot finally reaches its target. Behind the pericardial sac, the target heart tissue is cooked, producing scar tissue that won't conduct electricity, limiting irregular heartbeats. Then the pericardial sac is opened to expose the target area, so Zanotti can check the robot's work.
It shows clearly that there's no damage to surrounding areas. The lesions are discrete, and the surrounding tissue colored pink as opposed to the lesion colored white tells me that the ablation was successful.
The next big step? Testing the surgical SnakeBot on people.